Thank you so much for this coveted award. It is wonderful to be a part of the NRHA as we all share a common vision. I am deeply honored to accept this recognition, and I do so with great gratitude. Allow me to introduce myself. I am Dr. Teresa Owens Tyson, President and CEO of the Health Wagon. I'm a family nurse practitioner, and I have devoted my life, along with amazing like-minded individuals, to advancing rural health care in Central Appalachia, more specifically the southwestern portion of Virginia, where healthcare disparities are profound and resources are far too limited. I accept this award not only for myself, but on behalf of all those who show up every day to advance rural health care, the providers, nurses, outreach workers, staff volunteers, and partners who refuse to let geography, poverty, or circumstance determine whether someone lives or dies. I also dedicate this award to the patients in underserved and often forgotten places, the people in the hollers and remote communities and on the roads many would never choose to travel. They are the reason that we do this work, because the truth is simple. If we do not do this real healthcare work, people die. I feel that we have created a new model of care at the Health Wagon to replace disconnected services into a single integrative continuum of care called the Integrative Comprehensive Care Collective model that encompasses medical, eye, dental, pharmacy, mental health, initiatives that address the social determinants of health, and even veterinarian care with a focus on the One Health concept. As we all know, rural health care is not for the weak. Rural health is for the bold, it is for the visionary, and it is for those who are willing to look outside the box, to dream beyond barriers, and to create solutions and pathways for patients and refuse to leave even one patient behind. I certainly stand on the shoulders of others, such as Sister Bernie Kinney, founder of the Health Wagon, who is a Catholic nun, and my best friend, Dr. Paula Hill Collins, who we've been best friends from 14 and graduated 4 times together. Both these individuals have taught me that healthcare is more than a profession. It is definitely a calling. It requires us to learn advanced skill sets, to stretch beyond traditional models, and to create access where none exists. It definitely requires courage, and sometimes it means being bold enough to launch a drone into the sky because medicine has to move faster than distance. And sometimes it means calming your nerves before performing an advanced procedure that you never thought that you would have to perform, such as a cystoscopy over telehealth. And sometimes it means whispering a prayer before walking into a house touched by a deadly disease, such as COVID, and giving monoclonal antibody infusions. And sometimes it means driving winding mountain roads knowing that if you do not reach those people, they will never be reached at all. And that is rural health care. Rural health is so vitally important because, as we all know, it's the underlying fabric of a nation. And when people do not have access to care, everything else will begin to fray. Family, community, opportunities, and eventually hope. Caring for underserved populations in Central Appalachia, well, that has been my passion for over 3 decades, and I have truly loved every moment of it. And I believe this with all my heart. If we can create access points in Central Appalachia using an innovative model of care, then it can be done anywhere. So I challenge all of us to look within our own healthcare systems. Ask what more can be done for your patients so that they will have the best chance for not only living, but for living well. We are all living in a time that is challenging us to create new healthcare delivery paradigms. Let us be bold enough to answer that call. And thank you for this extraordinary honor, and thank you for seeing rural health. Thank you for honoring this work, and thank you for believing, as I do, that no one, no matter where they live, should ever be beyond the reach of compassionate, quality health care.